the Dean of the Dental School, Professor Ani Chandra, the academia that are present, my dear alma mater, King George Medical University, our dear lecturers of past and present, and my dear batchmates of 1979, and all the students and the guests present here. I bring you the warmth and greetings from the shores of South Africa, and the greetings of the universe that transcends all lands and oceans. And may there are blessings for you for infinity. My topic today is a myofunction dentistry, and I'll just give you a slight introduction of my background. My origin domain is South Africa, where I was born, and I live in a town called Springs, which is about 50 kilometers of Johannesburg and 70 kilometers east of Pretoria. It's a small town. It's the area of about 183.5 kilometers, and it's a province of Gauteng, which is called the business hub of South Africa. I was born in Durban, the coastal city of South Africa, and with my ancestral roots from my grandfather in Andhra Pradesh and Mysore and Bangalore. I'm intrigued by presenting this topic today on myofunctional dentistry, which is often not highlighted in the syllabi and the teachings of dentists across the world. But my association with the Academy of Myofunctional Sciences, the International Academy of Oral Medicine and Toxicology, the International Association of Biological Medicine, and the many exponents of mouth breathing and the integrated relations of dentistry and whole body general medicine. Diet and its significance from a functional nutrition perspective, the function of the body systems, including dental medicine. The first thing I want to highlight is about the aspect of the breathing. You all know that you have two air passageways to your lungs. One is the nose, and that's mouth. Healthy people breathe both through the nose and the mouth. Why is mouth breathing a problem or an issue in dental medicine and whole body health systems? The question to raise, do you have any of these symptoms? Breathing, you have two air passageways to your lungs, the nose and the mouth. Healthy people breathe through both the nose and the mouth. Technically, unhealthy people only breathe through the mouth. Normal mouth breathing is often involved in strenuous exercises, like, for example, cycling, or if you have nasal congestion due to colds, flus, and allergies. We all know that in strenuous cycling, the need to pass oxygen to your muscles is faster. Abnormal mouth breathing have long-term effects. Firstly is that the crooked teeth, and secondly is gum disease in adults. In children, mouth breathing can cause crooked teeth, facial deformities, or poor growth. In adults, chronic mouth breathing can cause bad breath and gum diseases, and symptoms of other illnesses can worsen, like sleep apnea, sleep-related breathing disorders, pulmonary dysfunction, and liver functions, in turn cardiovascular challenges. These numerous references of malocclusion and latent mouth breathing. The leading exponents of the world, like Louis Levine, literally Barry File, USA, Karen Lamin in Canada, Derek Mahoney in Australia, and James Nestor, who's written the book on breathing, and Dr. Stephen Lin, who's highlighted diet in dentistry and general medicine. Let's delve into a little bit about the science of nose breathing and the function to the biochemistry. It's the most natural form of breathing in healthy people. Consistent bad colds or blocked nose can reduce the quality of life, may also affect the ability to sleep well and general function of the body. The nose produces nitric oxide, which improves the lungs' ability to absorb oxygen. Nitrous oxide increases the ability to transport oxygen throughout your body, including inside your heart. It relaxes vascular smooth muscles and allows blood vessels to dilate. Nitrous oxide is also antifungal, antiviral, antiparasitic, and antibacterial. Helps the immune system to fight the infections. Dr. Joseph Wolf in the 80s wrote an influential paper on the subject of 70% oxygen, 30% carbon dioxide blended and administered the treatment of anxiety, and how it makes people calmer. The advantage of nose breathing. The nose acts as a filter and retains small particles in the air, including pollen. The nose adds moisture to the air to prevent dryness in the lungs and bronchial tube. The nose warms up colder to body temperatures before it gets to your lung. Nose breathing adds resistance to the airstream. This increases oxygen uptake by maintaining the lungs' elasticity. The aging out of integration of pranayama in dental medicine is obviously of great relevance today. And you could see the advantage of nose breathing. So, contrary to that, if a person is mouth breathing, it doesn't function to this optimal level of, example, moistening the air before it filters in the lungs, right? Hence, that it affects our pH balance, affects temperature, flow in terms of the air in the bronchial alveoli and the lung tissue. How do you know if I'm breathing to my mouth? You will not realize you're breathing to the mouth instead of your nose, especially while you sleep. People who breathe to the mouth at night may have the following symptoms: snoring, feeling bad breath, tired and irritable, brain fog. Dry mouth causes hoarseness, fatigue, and dark circles. Symptoms in children. A child may not be able to communicate these symptoms like adults. Children are more able breathing through the mouths open and will snore at night. Children who breathe through the mouth for most of the day may also have the following symptoms: slower growth rate, crying episodes at night, large tonsils, and daytime sleepiness. And it affects concentration. So the irritability phenomenon is correlated with problems with concentrating, dry cracked lips, and nasal congestion. How is mouth breathing treated? Myofunctional appliances like the Frankel bionated rapid and slow maxillary palate expansion and the myoblue system to correct mouth breathing are mindful habits, which in turn promotes correct jaw growth and naturally aligns the teeth. The system has always included evaluation of breathing as a priority, the first treatment goal for the last 30 years. With increased awareness of the prevalence of sleep-related breathing disorders in children, the World Dental Federation, the FDI, the American Dental Association, the American Association of Orthodontics have recommended screening of all children for sleep-related breathing disorders by dentists and orthodontists. This can be achieved by using the Myofunctional Orthodontic Evaluation form available from MRC Australia. Myofunctional appliances play a role in correcting ADD and ADHD. If a child who suffers with ADHD, then you know very well that some of the behavioral issues can come along with the development disorder. Thankfully, the MyBrace into the treatment plan system, the balance and concentration span individual also minimize the level of anxiety by increasing nasal breathing over mouth breathing. The potential indicators of ADD and ADHD, number one is the concentration. If you find yourself being easily distracted and inability to concentrate on daily tasks and productivity decreasing, this could be an early indicator of ADD and ADHD. If you have trouble completing the basic tasks, either at home or at work, this can be easily indicator of ADD and ADHD, which should be looked upon. Forgetfulness, disorganization, or basic data skills is an immediate indicator of adult ADD and ADHD. The clinical features is the impact of mouth and nasal breathing. You can see on the left-hand side, the girl that's breathing to the nose have alert eyes, and you can see that the shape of her nose, and you can see the closed mouth posture, and the straight chin, and the ideal cervical posture, and the well-developed jaw, and the good definition of cheekbones. On the right hand side, you can see it's got tired eyes, got a crooked nose, open mouth posture, receding chin, forward head posture, poor definition of the cheekbones, and the setback of the jaw, and the narrow face. That's the great impact of this. And we often realize that when this happens, what do trends do in the industry? They often have orthodontic surgery. Is it necessary? Can we overcome it with something more basic interventions? Something to discuss. How does myofunctional appliances work? Once the specific signs and symptoms have been identified, the priority is then to establish better airway function by opening the airway day and night, which has a subsequent effect of transitioning the child from mouth to nasal breathing, which is critical. So the functioning of the better airway, and that's the most important thing in myofunctional treatment. The first priority is to establish a better functioning airway so that the child can breathe without restriction. In my practice, I introduce a thing called the MyoBrace K0 as the first appliance to be used before starting on the rest of the program, as the treatment is priority to establish a functional airway as quick as possible for the patient with dysfunctional breathing and sleep symptoms. Why I use the K0 as compared to the rapid palatal expansion and the other appliances like the Bionature and Frankel, because it's got larger holes, it's got a larger tongue tie, the tongue to be repositioned upwards and behind the two front teeth, and it's got a platform for the tongue to be raised upwards, and it's got the big channels for the breathing. That's the reason I've got success in my practice by using this appliance. The correction of mouth is a fundamental first step in myofunctional treatment process. With children who signs of the medical condition of the breathing disordered sleep, priority to establish a functional airway first. The MyoBrace K0, as mentioned earlier in my previous slide, is an additional appliance to be used initially to set child unrestricted breathing during the day and night, and then you can switch on to any of the myofunctional appliances that you are comfortable in your hands. Appliance use. Children with positive sign of sleep disorders from a myofunctional on evaluation, and those obstruction of the airway is evaluated on a CBCT or ENT evaluation, or those who have done the pacer and nasal breathing test. If you're breathing and if you cannot hold your breath for 20 or less seconds, there's a problem. The design in terms of the ENT, the grade 2 or 3 tonsils, parents sometimes would prefer not to have an ENT referral. Children can keep so-called a basic appliance like the K1 in place at night, or the Frankel or the Bionature while they sleep at night. And this is the critical factor to understand what kind of intervention and when to intervene. Something that I like to delve into a little more in terms of the physiology and the pathology in relation to the function of the spleen and the liver, and whereby mouth breathing and insulin resistance. We all know that insulin and glucagon regulate blood sugar levels, right? So insulin effect on growth hormone results in hyperthyroidism and dementia and inflammation. Liver function, we know that is affected by carbohydrates, affect the ectopic deposition of triglyceride. Triglyceride increases glycogen deposit that increases the size of the liver. Right. In the oral cavity, what do we see? These changes from the liver function. The oropharynx has the inflammatory response of redness, the tongue size increase because the deposition of triglycerides in the tongue, and in fact, this increase of size, the tongue has to go somewhere, cannot go backwards because it will clog your oropharynx region. If you have a cold and flu, your nasopharynx, so your oropharynx compounds a problem, hence that the large effects of the tongue has to go outward, and it moves the teeth with that and the jaw formation, especially the maxilla, and then you have malocclusion. Diet is an important part, like Dr. Stephen Lynn said in his book. It's the most critical factor in understanding diet and functional aspects of dentistry, or myofunctional and orthodontics specifically. And because as I said earlier on, the reason for decreasing the carbohydrates, because you decrease the effect of the sugars in terms of the effect of the glucagon and in terms of the triglycerides deposit into the liver and deposit into muscular area like the tongue, which increases size. That's the reason why you need to decrease the carbohydrates, as on my left of my slide. And on the right hand side, what you need to eat the low GI food, unpolished brown rice, rye bread, millet, barley, sprouts, quinoa, chia seeds, and veggies with the plain rye flour if possible, and obviously tofu and the lentil pastas. This slide just in case from the modern day world of junk food, of the colas, of of all the fast food, donut, burgers, and all these kinds of things that we tend to delve into. And the right hand side in terms of the alkaline food, which is the fresh food which are more nutritious, and the middle part, pH 7, gives you the tap water and seawater. This is obviously a topic that we delve into itself, maybe at a later stage. COVID-19 pandemic has shown us the need for literature for integration of whole body approach in medical dental sciences. The role of the diet, understanding lung compliance, understanding cardiovascular relevance in terms of its markers, parameters of determination of healthy to non-healthy, the dentist's roles in mouth breathe, the lung compliance, what roles dentists play in the whole body system. Example of dental diagnostics and health markers. What if the health of our teeth comes with a problem like diabetes and Alzheimer's? Dr. Lynn said the healthy mouth affects a healthy body. The future of medicine is definitely interconnected. The oral systemic is an obvious example of the greater trend. A new understanding of the critical importance of oral microbiomes to overall health, and that's something that to delve into a topic of discussion. The breathing, the extraordinary act of breathing is, and why a great deal depends on it, as you witness in COVID-19 pandemic. My main message to you from South Africa: stay healthy, stay safe during this period of recovery. I thank you, the Dean of the Dental School, my dear friend Dr. Anish Chandra, Prof. Singh for the invitation, and Professor Singh for all the invitation assistance, and my alma mater KGMU, and my country of origin India. Jai to every one of you. God bless. Thank you.